Oh, he's shooting.
Ah! Even the noise. Nice. Oh, man.
Marge, what's happening?
Nice.
Oh, homie, you got chicken pox. What the hell?
I don't know. Oh,
Chicken pox are so itchy.
It's very itchy.
If you see on Homer, they did a good job. They're different sizes. A lot of kids nowadays don't get it, but when I was a kid, everybody got it. Homer getting it as an adult is kind of weird. It's not uncommon. If you get it older, there's more complications related to it.
You sit in this oatmeal.
Oh, nice. Good oatmeal tricks. A lot of times you'd use oatmeal if you got a lot of poison ivy on you as well. Even lotions nowadays, they use different types of oats in it to soothe the skin, decrease inflammation, more comfortable, and doesn't itch as much. I hope he makes it. Oh my gosh. Holy cow. Would he have survived that? If he's falling down the face of a cliff, but it's not flat, you potentially actually have a chance. Don't do these kind of jumps. Please be careful out there. At least wear a helmet. One of his legs looks totally jacked up. Definitely going the wrong direction. It could be tibia fracture, tibial-fibular fracture, mid-shaft that's displaced, or it could be a bad dislocation at the knee. It's hard to tell, but those are things you think about. And then he's got this big knot on his head, which is a hematoma. Oh, and then add insult to injury, his board hits him right in the head. We see a lot of people who come in with head injuries without helmets on. Somebody's hitting the head with something, they're riding a bicycle, they fall. A lot of times, like motorcycle accidents, they are wearing a helmet and the helmets are destroyed, but luckily the person's head is fine. Yeah, he's getting airlifted out of there. In a basket, they're gonna hit him. Oh my gosh. Typically, you try not to use the longboard that much anymore, but it's probably a lot easier for transport. Potentially put somebody in a seat collar, at least to stabilize the spine. There we go. Wow, that is a lawsuit ready to happen. He already had an IV with some sort of fluids running, looked like maybe some blood. Ambulances in the United States don't have blood because blood's always on shortage, so you don't want it to be in the pre-hospital setting. Oh my gosh. A little bit of TBI, a little traumatic brain injury. In sports, if you're high level and you're getting multiple concussions, there's a concern that you can get chronic inflammation, encephalopathy. So if somebody gets hit in the head, traumatic, and then passes out, definitely needs to get checked out.
I'm afraid he may never walk again.
What?
row your boat gently down the stream.
Homie!
I mean, at least he's having a good time in his wheelchair. My mother is an occupational therapist. When she was going through school, they required her to be in a wheelchair for a few days just to see what the experience was. It's very interesting.
Chocolate.
Oh, that's the worst. Sometimes patients will try to leave and go to the cafeteria to get food or go outside the building and smoke. That's really not allowed. We offer nicotine gum or nicotine patches for anybody who's smoking. Obviously, they get fed at the hospital if they're allowed to eat. Oh!
Just breathe, sweet chocolate.
I mean, if you're crushed by a vending machine, have you ever tried to like move one of those things? It's super heavy. You're gonna cause some damage or at least not be able to get that off of you. How embarrassing.
Poor Homer. This world was never meant for one as beautiful as you. Ah! Kill it! Kill it!
Please, he's in a coma.
Non-medicated induced comas. It's hard to know exactly what the cause is, and sometimes people just wake up. As long as somebody is breathing on their own and they're not on a ventilator for life support, it doesn't become an ethical medical issue. It does if somebody's on life support and breathing through their neck.
Coma? Why I go in and out of comas all the...
I love it. Well, maybe he has narcolepsy, basically where you just have a sudden onset of sleep.
This man is costing my health plan $5,000 a day. I demand that he die with dignity.
Obviously, I have nothing to do with billing and insurance and only hear about it through like the grapevine. Different insurances cover different things, so it's not the same for everybody. It's a whole can of worms and really hard topic to talk about and try to figure out. They've been trying to do this forever.
Hi, everybody!
Hi, Dr. Nick.
Why is he using a reflex hammer on his abdomen?
Oh dear, I see no signs of life. Just to be safe, we better pull the plug.
Yoink.
A lot of people fake being unconscious. So unfortunately, we do painful stimuli. Sternal rubs, putting a pen or pushing on the nail bed is very painful. We don't want to cause any permanent damage, but we need to know if you're okay.
Don't worry, people. We have enough vaccines for 1 child per family.
Holy cow. This is like hitting close to home. Typically, a new vaccination, you gotta use in adults first. Sometimes you can do it outside of the emergency department, but very rarely because it can clog out the system. 1 per family doesn't make any sense.
Yes, I'd like 37 snifters of your influenza syrup.
Give him what he wants. He's the only taxpayer in this town.
People tried to pull that card. No, it doesn't work. Like basically everybody gets treated the same.
Sir, perhaps we should get out of here before people start resenting you.
Different vaccines had to be room temperature versus cold versus reconstituted because it was freeze-dried. So there's a lot of different things that go into it. So you just don't give people vials or shots.
Hurry, everyone. Roll in the shards. Come on, like this.
Oh my God.
Healthy.
No, don't, holy cow.
Very sleepy.
What the heck? Sharing needles. That's how HIV can be spread. That's how hepatitis can be spread. Bloodborne pathogens. Don't partake in things like this. It wouldn't work that way anyway.
I want the brownie. I'm gonna get one.
No.
From the
Good
left.
chop his finger off.
The right.
Watch this.
Out for the reach around. Oh, he's shooting.
Ah! Even the noise. Nice. Oh man. If this does happen, hold pressure right to the end. Find the lost digit, wrap it in the wet paper towel, then maybe put it in a bag of ice.
We need more ice. My thumb is fading fast.
Don't put it directly in the ice bucket like that because it's going to cause a burn to the finger and could actually injure the thumb more.
Quick, Mo, Marge, cut off my thumb.
No problem. Just stick the old eye gouger in the pickle brine. That'll keep your thumb fresh and delicious.
What?
Thanks, Mo.
I've never heard of this. Now, if you lose a tooth, you can put it in milk, put it in your mouth, Hank's balanced salt solution.
I'm sorry, Homer. Your HMO doesn't cover this type of injury.
But I have finger insurance.
A thumb is not a finger.
Isn't there anything you can do?
What? Come on, what a bunch of garbage.
Symmetry, eh?
We don't care about that. You put the finger back on, figure out the expenses. Sometimes if you don't have the piece of your thumb, they'll actually take donor digit from somewhere else. They might take a toe, they might take another finger to put it as a thumb because the thumb is so important. Who doesn't like The Simpsons? These are always good, always entertaining. They always give us good talking points to figure out what the heck is going on, how it relates to what we do on a daily basis, even in the emergency department. So if you guys really enjoyed that, definitely check out this playlist right here, binge watch the whole thing, and please make sure you subscribe, turn those bell notifications on, hit that like button for me. Thank you so much for watching, and stay healthy, my friends.